Dr. Mackey, we are rolling. Thank you very much for being here.
Thanks for having me.
Yeah. Can you tell me what you do?
I am a traditional osteopathic physician. I'm a DO, and I'm also trained in family medicine, pretty much allopathically, traditional Western trained. So I'm a mix between a Western medicine primary care physician and something more inherently holistic, which is osteopathy.
When you take that term, osteopath, how do you define that?
So osteopathy has its roots here in the United States, and it started in Civil War times. And with Dr. Still, and he was an MD, and so he basically created this other art form of medicine where we are focused more on the structural relationship to pathological things that can happen. So in osteopathic med school, we take all the same tests, we take all the same boards, we take all the same MCATs to get in, and then we also have this additional piece of our curriculum where we use our hands to diagnose, and we learn to use our hands to diagnose and treat different ailments and diagnoses and issues with the body.
So are you essentially using your hands to feel what's going on with the patient?
We're trained to use our hands exactly to feel what's going on underneath the surface, not just what we're seeing, not just what we're um, taking in from things like lab tests or x-rays or the story, which we're taking into account because we're trained to do that too as physicians. But we have this additional input from our hands to say, oh, this area seems like it has lower vitality. This area seems like it's asymmetrical with the other side. This area seems like it might not be getting as much blood flow. This area might um, be operating, functioning less dysfunctional if we could get it more aligned or breathing better, as we might say.
How is that developed? Is that something that you acquire over time? You're kind of trained on that? Is it intuitive, or is there things you're specifically trained on? Is it a combination of the both?
Yeah. So the first day of med school, we were in the OMM lab, which stands for osteopathic manual medicine. And it's sort of an overwhelming first week. And then you go into the OMM lab and there's a bunch of treatment tables, like massage table type things. And they just say, okay, everybody take your shirt off. We're just going to start looking at each other's bodies. And so from that point forward, for 2 years, we're in that lab a couple of days a week, learning hands-on how to see the body, what types of things to look for. So the basics are very structural, like this is rotated left and this is side bent and this is restricted. And then from that point forward, in the current osteopathic medical curriculum, it's kind of like if you're into it, you have to seek it out. So you can seek out rotations with actual physicians who treat with their hands every day, like me, and rotate with them on for a couple weeks or a month, and you can seek those out. And then beyond that, I'd say the subtle things that I feel on the cranium and in the body, it took me about probably 6 years to actually feel what the teachers were referring to, of practicing. So it's a lot of refinement of the sensation of touch and perception through that avenue.
Hi, folks. Quick note from me. If you don't already know, the goal of Mountain Mule is to build real connection between Montana's businesses and the people they serve. And if you don't know what Mountain Mule is, we provide private transportation services and Yellowstone National Park tours. If this episode or any other has given you something worth thinking about, smiling at, passing along, I've got a small ask. Share it with a friend, text it to someone, consider following the show. Whether you're using our services directly or following and sharing the show, those simple actions help support this business as well as the businesses and guests that have been a part of the show. Thank you for supporting these Montana businesses, local jobs, and this beautiful state. Now back to the show. This is going to be the weirdest example. Are you ready for it?
Yeah, I'm totally weird and
Maybe.
ready.
So, on a dairy farm, when you milk cows, you feel their udder and you can feel when there's no milk. And it really does take a while to acquire that feel.
Mm.
But it's almost like you could like literally just touch the cow's udder. This might seem weird to people who aren't used to this, but this is very common when you're on a dairy farm. And you can almost just feel, and there's a lot of there's all kinds of stuff going on in the udder, and they could have edema depending on, if they've just had a calf, so they just got into lactation. But you kind of just get this, you just know, and you're like, yep, she's good. And there can be issues if all the milk isn't taken out, and or if you just leave a milk machine on a cow and all the milk is already out, because now you're just causing all kinds of irritation. But I can relate to what you're saying, only in this sense, at least. There's probably some others, but you just, after a while, it becomes instinctual. And it sounds like that's where you're at with a lot of
Yeah,
stuff.
totally. I think it's a great metaphor. I've never milked a cow, but it sounds like you grew up maybe doing that.
Yeah.
Yeah.
Well, I'm actually a little conscious now of saying I grew up on a farm, because shout out to my friend Steven, who said he listens to these, and he says I say I grew up on a farm about 15 times in every episode. So
Okay.
I just went straight into the dairy farm without any context. But yes,
Yeah,
Steven, I grew up on a farm.
totally. And like, I think that's also a great metaphor of of mainstream medicine today, where they're like, let's just try to take what the human to human connection can do, and let's just like close that down into like one or two factors and see if we can get a machine to do that, or see if we can like reduce it down to something that we can study in with data points and things like that, where osteopathy kind of zooms back out and says there's nothing that matches the intuition that we can have from human to human. Even, I think, with AI and all these things coming in, probably taking over medicine at this point, there really is nothing. I'm personally not afraid that my job's going to be taken, because it's really so much more intelligent than even what our brains can perceive of what the human body is, anatomically, physiologically, energetically, all these things. So yeah, when you grab that udder, there's a sixth sense. And actually, one of my teachers, osteopathic teachers, Dr. Dan Shadowan, he used to talk about this with patients in his office, where he would say, that's our superpower as humans, is touch. So dogs have smell, birds have sight, humans have touch. That's our thing. And actually, we don't realize it, but we are feeling things across. I'm feeling you through your eyeballs looking at me right now. I'm feeling somebody walk in the room, and I'm feeling what they're giving off. And so we're really perceptive. That goes into touch. That emotional kind of feeling into people is a form of touch, and it's really intelligent in us, relative to other species, and it's really our superpower. So that's what osteopathy and osteopaths, that's what we're kind of bringing into the fold. A lot of times, almost every day, probably 6-8 times a day, different patients, I'm talking about their experiences with other medical providers and how disappointing it was. And as we get further and further away in medicine from actually touching one another and knowing how to touch and knowing how to feel, and maybe there's a lot of reasons for that. We're interacting with our computers more than the person, etc. But the further we get away from one another, the less satisfying this experience of healing and growing and getting better and getting healthier becomes.
I'm with you, and I'm all about this because I made it a very conscious decision to have these podcasts be in person. It's just, for me personally, it's just something that I thrive on. And, just feeling the energy of the person, having the face to face, the eye contact, everything that I know, like, there's a lot of value in what technology can do, but it can't replace that, like, this experience. So I'm, yeah,
I'm always
I'm on board.
surprised. Like, you probably like read my website or whatever, and you're like, oh, this is who I think she is. And then I'm like here now in your office, and there's things that you're perceiving that you couldn't have on paper or through pictures or any other form of media. I'm always surprised. People come in with a big bag of their supplements and they fill out my extensive history form that's like 10 pages of questions, and they'll bring in a folder like with all their old labs and all the other workup that they've gotten from other practitioners. And I take in all that data. I read about them the night before. I think I know what I'm dealing with a little bit. And then I come in and I say, I get a lot of information from my hands on the table. So let's go there first before we come up with any kind of plan moving forward. And I'm always surprised what the body says and what my body perceives. And I always trust it much more than what the data is saying as far as a priority. What's the priority to treat? There's so many factors. And so I really rely on my body in order to hone in on what the first most important big rock in the bucket is going to be.
Do you know the book, The Body Keeps the Score?
I do.
Yeah.
Hmm.
I mean, that's what I thought of when you said that. Well, do you not, like, how much do you review all this information, that they've extensively filled out before you will have any hands on?
How much do I review it?
Yeah, well, do you review it all and then have this? I was wondering if that would, if that kind of skews your, like, the initial. It's kind of like if I told you about somebody and I gave you my really biased, negative or positive opinion before you had the chance to meet them and develop your own. And I kind of wondered if that type of thing happens in this situation.
I think I think that's just like a human thing. Like, we like to put people in boxes. We like to understand it. We don't like to have mystery and feel like we can't like grasp what's going on, like a form of control or whatever power. And I think that's really natural to try to put people in boxes. And actually, I would go so far as to say in regular mainstream training, we're trained to do that. We're trained to say, this is the COPD, or this is the chronic migraine, or and we put them in a box and they have a history of a heart attack, and we put them in this label, and then we're able to like kind of get into the minutia, the details of the story. But really we're taught to like deduce them down to these few factors, which I think is a big mistake.
Yeah, and I don't understand it in depth, a lot of the medical system, but from what I do understand is, doctors have to see X amount of patients in a day. So they're kind of like, they're trying to streamline things and get in, get out. What's going on? What are we looking at? Here's the protocol. Here's the treatment. See you in a couple of months, maybe. Uh, and you can correct me if I'm wrong, because I'm just.
Yeah, and it's a total problem with this system. And physician burnout is super high. The rate of physician burnout is super high because we're practicing in this kind of non-human way. I actually think when computers take over, it's going to be functioning a lot better. And hopefully we can figure out how to use the humans to be humans instead of just data collectors and putting in data entry. But actually, an interesting factoid is that not all DOs practice osteopathy.
What is the NDO is?
Doctor of osteopathy.
Okay.
Yeah. So you could go into the ER or the urgent care or your psychiatrist or your surgeon or whatever, and you might see that they have a DO on their name. And they were probably 9 times out of 10 be just functioning like any other MD. So you probably wouldn't even know to look at their name and their letters, credentials at the end. And the reason that is true, I think, is the systemic issue with how the system, how the payment works. Oftentimes people are paid more for production, and that means how many patients did you see? So most of the time, if you want to work in the system, which I don't, I opted out of working in the hospital systems. I opted out of taking insurances so that I could spend an hour with people. But when you want to work in the system and you want a salary and you have a family and you have whatever bills to pay and school loans to repay and things like that, if you want a salary, you've got to work for in this system. And to work in this system, you have max like 15, 20 minutes maybe with people. And it's just not enough time to do any kind of deeper listening or work. So they're trained in this way to, extrapolate information quickly because they don't have enough time to hear the actual story.
Yeah, and I guess for a lot of them, there's probably not a great like alternative option if they do kind of what you're saying, have all kinds of student debt and have if you were molded to fit this template, it's really hard to exist outside that template that you were essentially molded to fit inside of.
Yeah, a lot of DOs love osteopathy. If I meet a DO in the community and I tell them I'm doing osteopathy, they're usually so excited because they feel they have fond memories of being in those labs and learning that information, and they're just bummed that they can't apply it in their neurology specialty or their surgical specialty. And so, yeah, I can't remember what that last question was.
Yeah, just that they're kind of a product of their environment, so they don't necessarily have a lot of great options.
They don't have a lot of other options.
Yeah,
Yeah.
so they're sort of like I don't know financially and just I think when you're I don't know you become like you're a product of the the education and the system and I think we see that in a lot of things. It can be very difficult to operate outside of certain restraints just to survive financially or you know
Yeah, I think that there's definitely like a little bit of an ego piece
yeah
too. And I'm not calling I have friends in the regular medicine world, and I'm not calling them egoic, but it's like once you commit to like I was in school for 11 years. I was in training for 11 years to get out into the world and do this. And some of them are 16 years. And so it's like once you've put in that commitment, that level of commitment and that level of like getting weeded out and taking this test and people are falling off and you're still in there, and then you finally get to the end, you're like yeah, hopefully I know a lot at this point. And then to recognize, I think at some point in people's careers, they realize we actually don't know a ton after all of that. It's kind of depressing. So some people I see really gripping on to this, I guess, paradigm of like, you're either dying or you're okay. And there's no middle ground as far as like supporting health, because we're not taught that in
yeah
med school.
yeah. I mean, another gentleman did the podcast a while back, and he was a dentist. His name is Gene, and he was saying how he as a dentist would collaborate and work with a lot of different doctors. I know cardiac doctors and stuff that was going on, and there was so much stuff, information that could be exchanged, coming to more of a holistic approach, but that was so not taught. And I know like we didn't get too deep into that, but it's sort of this system to stay in your lane, you know, treat the illness, and I think kind of he alluded to. I'm paraphrasing a little bit, but we have great systems to treat disease and illness, but not necessarily a holistic approach to treat the person and find out what's going on, or prevent and just advocate for health.
Yeah, I mean, I think that there's a lot of reasons to explain why that is not in our current
Mm,
paradigm, and one of them being that uh, we're now in like an evidence-based medicine phase of things. Not that I'm against evidence, but in order to have good quality studies, you have to have high numbers of participants in that study. And how do you get high numbers of participants and physicians doing studies, you have to have money. And you have to have money. Usually, where do you get the money? It usually comes from a pharmaceutical company. Pharmaceuticals tend to be much easier to study because they're just one factor. You're not changing a whole lifestyle, or you're not really dealing with the personal story for each person. You're just changing one little thing. You're taking a pill every day. And what happens to the blood pressure or a couple of other measurements? What happens to how soon do you die? And so they're able to, again, reduce that into something like really tangible in evidence-based medicine, which is great for saving lives. I think there's no place in the world that you'd probably rather be than here in the evidence-based medicine realm, to get your heart beating again after you've died or after a major brain injury or something like that, a stroke, etc. My family members have been saved by these techniques and measures. But as far as getting healthy, it just happens to be a lot more complex than what can be studied in a reduced kind of evidence-based way.
And when you say no place other than here, you mean like this state, this like time in history, all the above, this
I
country?
think that, yeah, the Western medicine paradigm.
Yeah. Just for treating like these maybe traumatic things and certain things like that.
Acute traumas.
Yeah.
Yeah.
So what was your path through this? Did you like, was this a transition at some point, or did you pretty traditionally was this the path from the start?
The path from the start, yeah, I would say that it was the path from the start because I had a lot of weird things as a young person happen that were not explainable by, regular paradigms. And for instance, I was a competitive snowboarder as a teenager, and I had several injuries doing that, like freestyle type big air and board across and half pipe and things like that. I actually ended up fracturing my vertebrae 2 different years
Thanks.
doing that, and it just so happened at the same time that I stopped. My digestion got kind of funky. I wasn't getting my period. I was like 14 to 16. I still didn't have my period. I wasn't sleeping. I was anxious. I was, I was just starting to like experience suffering for the first time. And my parents would take me to the orthopedist, and they would say something like, "Oh, well, your constipation has nothing to do with your back." And my little 15-year-old brain would be like, but everything kind of started going wrong after I had those injuries. And they were trying to tell me that I was depressed and needed to be on antidepressants and put me on birth control in order to get so they just kind of, I saw that in my teenage brain, and there was something just not right to me about splitting the body up into systems and going to the OB-GYN for this and the psychiatrist for this and the GI doctor for this, and nobody was putting it all together for me. So at some point, I just started seeking out different healers, went to some great massage, some great PT, some great Chinese medicine doctors. I grew up in Chicago, and worked outside of this realm and was able to heal in other capacities much greater than I was with everyone denying me that these things were real or that they were important or that they were connected.
So this sort of started this journey of seeing like, no, everything's working together, and I'm seeing how this is related to that thing. And these doctors are telling me like, no, let's just treat this one thing locally. It's completely separate from what went on with your injury, or maybe what you're eating or anything above.
Yeah, exactly. And just reassuring me that going ahead and pushing through with my life was an okay thing to do, even though I was feeling like SHIT.
Yeah.
And I learned pretty well how to push through suffering. And, it's taken a lot of years to unravel that mentality of push, push, push. Um, and that's more complex, but um, I just wonder what it would have been like to feel like wholly supported in that moment in history in my life of like being believed and seen. And that's really like what I try to do as a physician. I try to take that story in and take it really seriously and listen to the words that they're saying. Usually, I think there was an actual like Western medicine, like mainstream study from JAMA or whatever that said like 80 to 90% of the time of people in the ER, when you ask them what they thought they had going on, they were correct.
Okay.
So
Yeah. Yeah.
it's like, yeah, just listening to people, I think is really important. So I learned that at a young age, and I learned that medicine was not doing that. I thought maybe I want to be a PT and work with people's bodies. So I got to go, I guess explore that during college and worked with my uncle in Minneapolis and got to see how he works with the body. And he at some point he said, you could just do one more year of school and be a doctor and have a lot more autonomy. And that's when I found osteopathy. And I didn't really even know what osteopathy was until I was like in that lab the first day of school. And I realized, oh my God, this is the thing that's going to tie everything together for me. And, addition to the Chinese medicine and the yoga and all the other things that I had experienced at that point.
So had you, for your own health, had you felt like you had found this point by then when you're in school of, like how to approach treating yourself and taking care of yourself more holistically?
Yeah, for me, it's always been like experimenting on myself to learn. I'm a tactile learner, and I can feel things really deeply in my own body. And I think that's been a blessing and a curse because I'm so sensitive, and it's been hard to at some points feel like I'm like a normal person because I'm like so sensitive. But at the same time, I've been able to learn a lot of lessons by getting treated by great healers. Now I get what you're talking about, and now I can go do it. Um, and a little bit of wait, I lost track.
Oh, yeah, I was just asking if by that time you had kind of felt like do you have it pretty dialed as when you're treating yourself, at least when you were
Oh yeah,
going into school or
when I
starting
was
this
going into
practice?
school here, so I went to I got into med school and I took a year off and I deferred my acceptance in San Francisco. I went to the osteopathic school there and I deferred and I traveled around the world and I went to India and like stayed in ashrams and did my little travel around the world thing. And at that point I was a yoga instructor and I came back and I was teaching yoga in San Francisco and I was actually like really nervous to go to med school and be kind of, for lack of a better word, brainwashed into like forgetting all of these really important other lessons. And I remember a specific conversation with a yoga teacher of mine. I said, what if I lose touch with yoga, or what if I lose touch with all of this? And she's like, if you don't want to lose touch with it, just stay with it. And so I integrated these experiences. I tried to, year one of med school, I was teaching yoga to my fellow classmates and starting the integrative or taking on the integrative medicine club and just trying to stay in touch with all of these concepts while learning this other kind of Western approach.
So will you use any Western medicine in your practice now?
Definitely. I feel really grateful to have had my family medicine training. I went to the University of Nevada, Reno, and there was one DO, but I think for the most part, it was MDs and MD faculty. So I would say it was a very like non-holistic training, and at that point, it was my weak point was like the allopathic approaches, and it was 3 kind of hardcore years for me of being a resident and working in the hospital, and the steep growth curve and all of that stuff, learning curve. But I don't think I would do it any differently at this point, because I am confident that I'm pretty confident that I can trust my intuition on that piece, to be not trying to treat holistically, and this person is actually having rheumatoid arthritis or something else that needs to be diagnosed acutely, like a pulmonary embolism, or something that maybe other holistic practitioners wouldn't feel confident tuning into or diagnosing or supporting. So I definitely use medicines. I will play the role of primary care provider if somebody really is persistently wanting that. And however, I usually encourage people to kind of keep their primary care in network, because they can order all the screening very easily and get it covered insurance wise. And I consider myself like a second opinion primary care almost.
Okay. That's what I was going to ask you that. So that's where you'll advise them, because they can use the system more tactically when needed, and also, refer and defer to you when they feel appropriate, and when they want a little bit of a more broad and holistic.
If they want a holistic approach on their acid reflux, that they're supposed to take these indefinitely, take antacids for the rest of their life, and they don't usually, people don't want to.
Yeah.
I was actually surprised, like, for the first couple of years out of residency, I worked in urgent care in Los Angeles, right by by LAX.
Okay.
And so I was treating people from all walks of life, because sometimes they come from LAX and they be from some other country. The whole spectrum of socioeconomic, uh, standing, or whatever you want to call it. And 100% of them, I would say, like, just so you know, you're in urgent care right now and I can't do this for you, but there's another way. If you're interested in your kid not getting recurrent ear infections, there's another way to deal with this. Or if you're interested in, like, getting rid of your thumb pain, like, I have to start with like an x-ray, which doesn't help you, because that's what insurance companies make us do first. But there's like a really quick way to get rid of this pain. And they were 100% all interest, no matter where they came from, speaking English or not. They were like, yes, can you give me that information? It's just, unfortunately, not all of them have access to an osteopath.
Yeah, I think a lot of people probably don't have that thought or never ask that question. So, do I find out what's causing this, rather than do I just keep continually treating it for the rest of my existence?
I think people do have that thought. It's just like the physicians and the system isn't having that thought. And so they're just drilling into their head, like, no, you have this, and this is how we've labeled you, and you have to do X, Y, and Z. Otherwise, you're going to get cancer, or like some fear tactics in there. And unfortunately, those MDs or DOs that are saying those things just aren't trained out beyond those things, beyond those measures.
I was telling you about my friend Gene. He had a cancer diagnosis, I think probably when he was in his 50s, and the way he said it is he accepted the diagnosis, but he didn't accept the prognosis. So he just took a much different approach. Like he wasn't in denial of what was going on, but he took an approach of, what is everything I can do to be as healthy as possible, and maybe find out where this may have come from, and treat it. And he's cancer free from now,
That's amazing.
as far as I know, and it's
Yeah.
so it's 2026 now. Like, do you think this has improved people having these thoughts and people having access to alternative care and/or medicine, or do you think it's going the other way, getting worse? I mean, what do you see from your side of the field?
So when I got into practice, which was 2014, and I was working in that urgent care, or even before that, I was always surprised at even the people that you wouldn't think would be thinking about this stuff, we're thinking about it. And I think that uh, it's only grown. The interest in root cause healing has only grown. I think that it's not growing fat. The the science and the support around healing people holistically hasn't grown fast enough to keep up with the demand, quite honestly. But yeah, like your friend doing cancer treatments and taking in all the information from the Western aspect and also asking the question, what else is there? Like, I think that's what I'm trying to do in my practice with my training. I've gotten both sides of those pictures, and it's like, why can't we just take all of the good things from everything
Yeah.
and leave the rest? And I think that a lot of people, a lot of patients, no matter what their background is, would be agreeing with us right now.
And I always think that same thing too. It's not like all of one thing or all the other, but there's been some great, I think kind of as you were saying earlier, a heart attack or stroke, we're in a great place for that stuff to be treated. There's been some awesome advancements in medicine and some miracles, but it's not a just like that's the only answer, but the combination of both is a really exciting time if you can find a way like, like it sounds like you are a way if you can find a way to have that, to have both. And it's I don't know if it's a tall order, but it takes a little bit more nuance and approach than
Yeah, I honestly think the patients are waking up quicker than the system is. It's kind of a dinosaur, the mainstream medicine. It takes a long time to change those protocols and a long time to convince people. And I think the more, I don't know, maybe this like public service announcement on a podcast like this is like, the more you keep asking questions and stumping these physicians, the more they're going to be like, even if they deny, like, oh no, that's not a thing, they're going to go home and start thinking about it. And the reason that I say that is because I'm I'm friends with a lot of physicians. I've treated a lot of physicians as patients, and actually, my one of my osteopathic teachers, Stefan Hagopian, said this. He said, "So the DOs out in practice, they won't send their patients to you, but they'll send their whole family to you. So like they believe in it, they just haven't been able to buy into it yet with the whole system. But like when something's really wrong, they're gonna go seek. When something's wrong with them or their family, they're gonna go seek outside things. Unfortunately, I think that's how a lot of physicians, like my story, um, get into this is that they've suffered themselves, and it's the only way they start thinking differently.
it's got to be you go to school for 8 years and learn something that's like there's some calluses for sure. It's not like you're just going to hear an alternative and think, "Man, was I not lied to, but was I misinformed or was I misguided a little bit and now do I have to rethink half of my approach?" And that's not a easy pill to swallow.
Yeah, a lot of physicians going back to do functional medicine trainings or, um, you know, whatever else, Chinese medicine, whatever else they're adding. It's kind of like, oh my God, there's like a whole other body to learn. There's a whole other med school to learn. Thankfully, functional medicine has some of the same biochemical pathways that they're talking about. They're just looking at it a little bit differently, but there really is so much more, in my opinion, than what is taught in medical school.
And you said you taught yoga. I don't know if you still do teacher practice. How how broad do you think of treatment? Because you could think of, movement and then you could think of nutrition and then like is there a sort of mental approach and framework you think about too as treatment or just as health in general?
Definitely. I think there's so many doorways to go through in order to reach that center point of like holistic care. For instance, like through the physical body itself, through the systems of the body, how you detox, through the psycho emotional spiritual, through the structure of the body, and things like yoga and Ayurveda. And you mentioned the body heat score. So that's a somatic experiencing approach to therapeutics, which is like soma means body. So it's a body based form of psycho spiritual emotional work. Dr. Klinghardt, who's one of my teachers in the Lyme co-infection and chronic pain world, chronic persistent infections. I actually did a psychoneurobiology workshop with him, which was really great. And so I would say on the hierarchy of healing from chronic situations, so we're not talking about healing from your heart attack or surviving a heart attack. We're talking about healing from decades of low level persistent stuff. That the psycho-emotional spiritual realm is probably the top of the pyramid and then it trickles down into the bottom. So you could address a physical issue from the physical body, or you could definitely address it from the spiritual body as well. And that's where yoga comes in. It's a system developed thousands and thousands and thousands of years ago, called the koshas. The different Patanjali came up with the koshas, which is the different types of bodies. So the food body, the main body, the mental body, the emotional body, the spirit body, all stacked on. Sometimes it's depicted like in concentric circles, like auras around you, and that we're living inside all of these bodies all at once. So in order to heal something that's persistent and chronic, it probably means healing from all of those layers.
And you're saying the top, like if you really want to get to the core, essentially, in your opinion, that's at the top, and then it kind of flows down from there through every other part of the human experience.
Sometimes treating a physical problem from the physical body does work. For instance, like some people love their PT or their chiropractor, or and they just know they can do their exercise and they're good. Probably that problem wasn't a deeper issue. It's those things that aren't responding to the physical treatments, the medicines, and the PT or OT or any of the physical kind of approaches. If they're not responding, if they're persistent in spite of that, then you kind of got to keep going up and up and up. So it's like, even with like chronic Lyme, and we're doing hardcore IV antibiotics and vitamin drips and ozones, and a lot of there's people who don't respond to those things, and then it's just like, okay, we got to keep climbing up that spirit ladder and going into the weirder realms.
Yeah. I mean, yeah, there's some stuff that just like persists, and you kind of got to think like, what? I know what this is, but why is this? And then I guess that's where on the ladder is the why.
Yeah, and a lot of times it's a trial and error. I use a system developed by Dr. Klinghardt that uses muscle testing to prioritize what needs to happen first, in order to get to that core problem to treat. And that I like to think that approach helps me quicken the process. But even so, with complex chronic illness, it can still take a year to start shaving off these different layers and doing these different practices, doing these different medicines until you're starting to really get to the core of the matter.
Do you ever have a patient or try to get a patient to, feel into their own body and their own experience? And like, maybe like if you said to me, like, Tim, like, how does this feel? Like, what's going on? What do you think about, like, to help them diagnose? Because depending on, I guess, how in tune you are with your body, you might have some type of knowledge of what's going on or where it's coming from. But like, so you're ever trying to bridge that gap between what they're feeling and experience and what you're perceiving from them?
I think a lot of people are hungry too.
Hmm.
And I wish I was better at digging a little bit. I'm not trained as a somatic therapist, but oftentimes spontaneously, as we are like just physically, I have my hands on somebody and we're feeling and like kind of allowing information to be shared between two people's bodies. It's a really intimate process. Um, but a lot of the times there'll be an emotional release that naturally comes out. I usually, unless somebody's really into it or they're primed or they, the way they speak, they've already done some of that work, then it will dig a little bit more into that direction. I always like to refer to a specialist who, if we're going to start opening up Pandora's box, I want to know that they're safe doing so. So I usually like to work uh, in conjunction with somebody who specializes in trauma work or specializes in somatics, etc. But like for instance, um, sometimes it's like not somebody who is super emotional. And one person I can think of is somebody who works at a local ski mountain here as a ski patrol. Real tough,
Mm-hmm.
tough guy. And was sent by his wife after having a blast injury from the dynamite going off too close to him for the avalanche control. And that's a really big deal. By the way, it's like a really hardcore way to get a concussion. Same thing with PTSD from like blast injuries from the Gulf War or being in the military. And it can cause a lot of chronic issues. So his wife sent him, and he wasn't really even sure what I was going to do. He was kind of skeptical, and I put my hands on his head and started to just sort of work with the tissues, work with the physical body, and actually started feeling like him. It was like he had exited his body, which is really common in the Body Keeps Score, that kind of Peter Levine somatic experiencing stuff. We often, during traumatic events, we will dissociate.
Mm-hmm.
And so I was like, okay, he doesn't seem to be in here. And so I just sort of like making space for him to kind of reoccupy his body. And as soon as I acknowledged that separation, and he started kind of like coming back into his body, I could feel his feet from his head type of thing. He starts crying and crying and crying.
Wow.
He didn't know what was going on. He doesn't have he's like a tough person. He gets up and he's like, I have no idea what just happened, but I feel amazing. And I actually only saw him like one more time for that blast injury, and he was good to go.
That's very interesting.
It's super cool stuff.
I want to ask you like about, Reiki healing or Reiki healers and like how, like if a lot of that ties into anything that you do or what you know about that. I had a friend that told me he saw like God saw maybe one a couple times and like he just told me about the experience a little bit, but I only have that real cursory understanding of it.
Yeah, I'm not trained in Reiki. I've gotten treated a couple of times in that capacity, and I would put them, if we had to put them in the kosha layers, I would put that in the energy body. And so just like you can heal a lot of different things from the physical body or the emotional body, you can heal things from the energy body too. Sorry, I keep hitting the mic. And so you can trickle down by working with the energetic body, the frequencies that are given off by our body, the frequencies that we like, I guess, take on from other people and other situations and shock and trauma. By working with those energies, it's possible to start working with, healing a sprained ankle or something on the physical realm. It's definitely like theoretically in my mind, I see how that works sometimes.
So in all this work, it sounds like you've been practicing over 10 years here. Is that right or no?
In Montana.
Yeah.
So I have been here for 5. I've been practicing as a traditional osteopath since 2014, so about 12 years.
Okay. If you took your 12 years of experience, like, is there any large things that stick out? Like just in general with people you see, or like things that are, big mindset shifts are just helpful for people like along this and I know that's a very broad question, so like
So I tend to see something similar to what I just described with the blast injury. A lot of people who are walking around with chronic persistent symptoms, whether that's a chronic ankle sprain or gut pain or diarrhea or um, something emotional, where that's a chronic pain of sorts, and that's a chronic trauma of sorts, and so we tend to be dissociated in those chronic uncomfortable states. And so even though and that's for a reason, by the way, like tuning into your body when it's not functioning correctly is not comfortable. But I do find that in order to heal, we have to occupy the body and not be just out there in the ethers dissociating and supporting that dissociative state. So whether you're dissociating through screens or Netflix, or you just like we live in a mountain town, so people are like, I'm just going to keep doing my ultra marathons, or I'm just going to keep pushing it. Um, that that often is making the problem worse. And so I often find myself inviting people to like take a step back into their body. I'm giving them like meditative exercises, breathing exercises, etc. Just mindset exercises to like slow down. And that's actually like one of the things that comes from Ayurvedic medicine is like I'm not an Ayurvedic doctor. I'm not officially trained, but I've dabbled in that. I've taught for an Ayurveda school, and one of the take home points that I know about Ayurveda is like when in doubt, you're going to balance the Vata energy, which is the energy of air and ether. So all of us are a little bit off in the ethers these days. There's a lot of distraction. There's a lot of ways to not be in our body, and so healing as a whole, as a civilization, as a world, I think it's a essential thing for us to be kind of coming back into the ground, into the body, into the earth, and that could be applied to a lot of different, you know, geopolitical things too.
so you're saying if they can essentially reassociate with the body, with what's going on, that can be, one of the first steps in treatment and, taking care of whatever this chronic thing is. And that is, you can correct me, but are you saying like breathing and kind of like doing maybe these movement practices is what gets you back into the body to be associated with it and figure out what's going on?
Yeah, and it's not just like going to a yoga class. Like you could go to a yoga class and get more dissociated by just like making this a physical exercise, for instance. But it's really like the most simple things are and things that are free, like breathing into your belly, um, sitting down to eat, just like really, really simple things, slowing down enough to digest your food. Um, we have so many reasons to not slow down, but it turns out our nervous system is still functioning like the humans that existed thousands of years ago before all of these distractions. So we haven't caught up evolutionarily. Cortisol levels and nervous system wise, we're still just like basically in like triggered in fight or flight all the time. So if you want to understand it in a different way, it would be like treat the nervous system first.
Do you know much about the Wim Hof breathing or the Wim Hof method?
So every time I do Wim Hof, I like freak out. I like freak out. It's too much for me. I'm too sensitive for it. I think a lot of men gravitate to it.
I was gonna say I like it.
Yeah, yeah. I feel like it's like a bong rip of a breathing exercise for me. So I'm like a little bit more sensitive than that. But like everyone has a different baseline level of how sensitive they are. And so some people need like a bigger dose to feel these things and respond.
Mhm.
And so I always invite people I try to meet people where they're at. And, sometimes it's much more subtle than a Wim Hof. But if it's Wim Hof and cold plunging
Yeah.
for you, like, that's great. Whatever is going to get you, like, your nervous system back to that baseline level.
Yeah. I've gone back and forth because sometimes it's like helpful and then it becomes another obsession and unhealthy. So it's like
Is it agitating?
the cold plunge can get like
Yeah.
depending on why I'm doing it. Like, am I trying to, accomplish break some record or accomplish something, or am I, doing it because it actually offers some relief and some recovery?
Yeah. So there's like an intentionality
Hmm.
difference there,
Yeah.
which is just really, it's like a totally free thing. What is my intention in doing this? Oh, wait, it's for me to be intense. Maybe I shouldn't do it today.
Me and my fiance will go to the new bathhouse that opened here in town, and we will have that conversation a lot. Like, let's listen to our bodies. Are we just pushing ourselves? Or are we actually coming here to relax and recover and rejuvenate? And it kind of depends on what's going on in our lives and in our heads and our bodies. And so that's why I say it's been it depends on how I'm approaching it and what I'm looking to get out of it.
Yeah, totally. And that's just even asking the question can make that intention shift, I feel like.
Hmm.
So that's great.
But that cold plunge is cold there.
I've never been there.
It's
I'm
cool.
excited to
It's
go.
cool. Yeah, I definitely recommend it. That cold plunge is because I've done plenty of cold showers and Wim Hof stuff over the years of curiosity and research. But that's like I feel like that's the big leagues of cold
This
plunges,
is the big leagues for
and
sure.
the water's moving in there, so you don't get like warm after a minute. If you're still and the water's not moving, it's just like circulating cold water.
That sounds hard.
Yeah.
I did a lot of research recently for this deeper detox. I got a lot of women to sign up.
Mhm.
And I did a menopause talk before that. So I was researching um the different benefits of hormetic stress, which is like cold plunging is like actually bringing putting the cold onto those peripheral receptors on your skin actually does something to you on a cellular level and starts, shifting you from one type of fat, metabolically inactive fat, to an active fat. And in that research, I actually discovered that for women, that the temperature is a lot higher than for men in those cold plunges. Like it really only needs to be like 60
Oh wow.
for women. I mean, maybe for some men too, probably. Turns out we're all like different.
Hmm.
Yeah.
Yeah, no, I think the one at the Bozeman Hot Springs is around 50-ish.
Yeah.
Um, and that's cold, but that's much more manageable. When you get in the 30s, it's like
Yeah, that's
it bites pretty
something
good.
else.
I was gonna ask you if there was a male female, if it's really skewed largely one way or the other in your practice and patients or in general. I know I practice yoga fairly regularly, and it's obviously, I mean, I don't know if it's obvious, but it's definitely very skewed. Like I don't know, it's not like 10-1, but it's like 10-3.
Yeah, you're a man who practices yoga. Why do you think that is?
Because it's like at my wit's end of other options. It's like, you could try like everything that seems like the natural solution is work harder, do more, and take care of myself, keep myself in good shape, but realizing I need more of that yin side, like that's what I need. Like I guess to go a level deeper, like leaning more into the feminine side of what I need. Like, and I've realized this as I've gotten a little bit mature and older is not like a more balanced human being can embrace both sides of that. So when I do go to a yoga class, I'm looking for something that's very yin, very restorative, because a lot of what I'm doing in my daily life and in my fitness journey is very yang, so I'm not looking for a power anything. I'm looking for like stretch, relax, recover. Um, I think it just seemed logical because of like I've probably tried every other avenue before, believe me. But I try to say that you know, as much as I can and as much as necessary to friends and like other men to encourage it because I see a value in it, but it's also not for everyone. So I don't know.
Yeah, it's not. I mean, that's pretty advanced, I would say. There's differences, no matter what people say, there's differences between men and women in our current culture, in my opinion. And to recognize that in yourself, that you're prioritizing slowing down and, as you say, the yin aspect. There's ways to do yoga that are yang, for sure. And I see a lot of people in yang based yoga classes that should definitely be in the yin. Usually we gravitate towards what we actually shouldn't be doing.
It's funny you say that because that was where like I started doing the hot, the 90-minute hot yoga classes because that was like the most acceptable thing I could be doing as a man is like the hardest option.
Yeah.
And then I like I said, I just finally wore myself down after a while and was like, all right. I give up.
Totally. And that's how I started with yoga too. I was in Boston for summer school and I went to a yoga class and I had been a collegiate athlete. So I was like, I want the hardest, most physical, and was looking at how easy that girl was able to hold her leg out to the side and grab her toes. And I was comparing and doing all those competitive things that we are trained to do in athletics. And then I went to a yoga teacher training. I was 21 years old and lived in an ashram. And I was like getting fit in order to go there because I was like, this is going to be hardcore. And it was Shivananda yoga, which is like really, really, if you're not familiar with it, there's like a shavasana in between every pose.
Nice.
Yeah. So you do a pose for 5 minutes and then you shavasana for 5 minutes. And you do that for 90 minutes, typically. And so when I got there, I was like, oh my God, this is yoga? Like I had no idea. And I'm so glad that I had that first training because it really isn't a physical practice for those who are considering getting into yoga. If you can do the thing that you're not really gravitating towards or give it a try. Yeah.
Yeah, the hardest yoga class I ever did in my life, this was within the last couple of years, and in the beginning, I don't remember who was teaching it, but it was a studio here in town, and the teacher she said like, if you're not like if you're like if you're laying down on your back and that feels good, like just stay there, listen to your body. And I was like, all right, I'm like I'm at my wit's end, I'm exhausted, I'm just gonna stay here. I did it for the whole class. I swear it was like the hardest thing
It's hard.
because internally I'm like, what am I doing? I'm just laying here. Everyone else is doing it. And then like that voice was just gaining momentum. And then it was such a different battle. It was not a physical battle, but it was an emotional, mental battle. And it was very interesting to see that after. I'm like, one of the guys was like, man, you were like, that must have been so nice. I'm like, yeah, it was. It was a battle, but it was nice.
Yeah, exactly. After that like 6-week Shivananda training, I had already been like a competitive snowboarder and like a collegiate scholarship athlete and all of these things. And at the end of that 6 weeks of doing like a lot of shavasana and a lot of chanting and a lot of praying and meditating and sitting still, which was very, very painful, I've honestly never been in better shape in my whole life physically. Like I had like a 8-pack at the end of that. I have no idea. But I was very confused at why that happened, but I kind of get it now.
Yeah, that makes complete sense.
Yeah.
I like for what it's worth too, and I'm engaged now, and I always thought this when I was dating, and I would always think of, like who do I want to date? What's my type? Yada yada. But I had that mindset in my head is, man, or I appreciate like that can embrace this feminine side of me and be more well-rounded. And I would think of that in a woman as I didn't like I wasn't looking for a woman that was just so feminine, and then, at the same time so masculine, but like appreciation of when I can see both, I really appreciate it because I see a whole person that's like leaning into both sides. And it's like that's not the easiest thing to do. So
Yeah, it turns out we're all both.
yeah.
Yeah.
Yeah. It's just like
Yeah.
in this society as a man, like saying that is like, no, I'm a man. Like everything's masculine. And I think that's probably like felt on both sides.
Yeah, it's the same conversation as like the mainstream medicine,
Yeah.
in my opinion. It's like black or white.
Yeah.
You either like are going to die or you're fine. And it's like you're either like super masculine or you're super feminine. It's like, no, it's actually, there's a whole spectrum of things going on. It's much more complex. Sometimes you play the masculine in your relationship, I bet, and sometimes your fiance plays the masculine, and it's the dynamic dance, as they say.
Yeah, I mean, she was at one point in her life, she was a career firefighter. So,
Yeah,
um,
that makes
and
sense.
like we're like she's very much in a different place in her life, and like so am I. But it's like that to me is so cool that like we have that range. It's
Hmm.
fun. You said college athlete. What sports did you play?
I played field hockey at Northwestern.
Oh, nice.
Hmm.
How was that? Did you enjoy
Uh,
it?
yeah, I loved playing field hockey in high school,
Hmm.
and it was my experience with playing college sports. It was really neat. Like at first um, to feel like really special, and you get shoes and you get a locker and you get all this gear and um, trainers and doctors taking care of you and like a lot of attention and all of that. And I think I I think I thrived in the team environment. It's just that like when you get to college, I think that there's a lot of leaders and no followers. Like everyone's the captain of their high school team. And
Oh,
so for
interesting.
me,
Yeah,
like the dynamic of the team just wasn't keeping me on the team
yeah,
anymore.
that makes a lot of sense because
Yeah.
that's who would probably pursue that career further than high school.
Yeah, exactly.
Yeah.
So it was like maybe it just was random that that was the group of people that I landed with. I'm sure people really I know people really connect with their college teammates. Um but I ultimately quit after 2 years and had a little bit of like a spiritual awakening through that. So I'm glad that it all happened the way that it happened.
Yeah. What about like now in your free time? Are you like any sports? Are you still doing yoga regularly and that kind of stuff?
I do yoga pretty regularly. I find that when I do it like more than a couple times a month,
Mhm.
like officially at a class, that I'm kind of like agitated a little bit. So I'll do like a few minutes of it here and there on on a daily, almost regular daily basis. Um, and talk about it all day in my practice.
Mhm.
And as I'm treating people, I'm kind of like doing a yoga pose. So I've integrated it into my daily discussions, into my daily thoughts, into my daily meditations. But I would say I move more towards the spiritual practice of yoga than the physical.
It was 2019 when I first moved here, and that was basically my first, I think, yoga class that wasn't hot yoga. So this is, I don't know, I guess that's almost somewhere around 7 years ago. But I signed up at this place, and it was like $30 for 30 days. So you
Hmm.
had
Hmm.
unlimited classes.
Hmm.
So I was like, all right, well, I might as well just send it. Like, uh, I have these tendencies to like, I don't know, just go all in. So I did it for 30 days straight, did a class every day, and I was definitely a different person at the end of the 30 days.
It's transformative.
Yeah.
Yeah. I find so that asana practice in yoga and the 8 limbs of yoga as you speak about it like traditionally is the first step. It's like the cleansing and the purification of the physical body so that you can get to the next steps.
Yeah.
And I'm not sure that everyone who does yoga realizes that. Not that like you're better or worse for liking asana practice. I think some bodies really benefit from it. I happen to be like a really hypermobile, too loose person. So it destabilizes. I know that about myself. But if I focus on the strength and don't do it too much, it's not too agitating to my spirit.
I remember noticing the biggest value that I got from it, and that's why, I make it a point to do it once a week now, is the breathing. Because I
Hmm.
would realize that the breathing was happening more automatically and unconsciously outside of there. And that, like, for me, that's I just see the benefit of that, in the current moment. And when things are getting stressful and I'm like, there's way too much in my head, I'll catch myself holding my breath.
Mm.
And then I'm kind of like, because I'm just kind of clenching into, whatever's going on. But that flow just, between the breathing and the movement just like really helps let go a little bit.
Yeah, exactly. Pranayama is the practice of breath prana is energy, so movement of the energy, and we use breath to do that. It's this bridge between our automatic body and our motor, or our what's the word? Like
Conscious.
voluntary or
Okay.
conscious body. And so it's a really great way to invite the unconscious body to do something.
Yeah.
Yeah.
It's nice when it like helps out and remembers to breathe a little bit deeper.
Can I show you a pranayama breath right
Yeah.
now that I really like to share with patients?
Yeah, please.
It's on the topic of bringing you down from the ethers
Okay.
down into the earth. And so, and that comes from the more tantric practices of yoga. They're bringing the heavens down to the earth plane. So what you're going to do is you're going to take a big breath, and you can do it while I'm talking you through it. And if you're listening, you can do this too. So you're going to take a big breath into your chest, filling your heart space forwards, backwards, left, right. Expand as far physically as you can, and then hold at the top. And you're going to hold that breath for as long as is comfortable. You're forwards, backwards, left, right, like a balloon. Good. Try to relax your shoulders. Exhale half of that breath that you inhale, half of it out. Stop. Inhale whatever was left in your chest cavity. Breathe it down. Inhale into your belly, forwards, backwards, left, right. So you're filling your abdomen space. Your pelvis is filling, not literally with air because our lungs aren't down there, but you're just pulling that energy down into your belly. And then when you need to, you're going to exhale down and out your feet, as if you had mouths on the bottom of your feet. Yeah, I'll try it again. So big breath into your chest. Hold it, forwards, backwards, left, right. Relax your shoulders, expanding heart space. Exhale half the breath out. Stop. Inhale whatever was in your chest down into your abdomen, filling in behind your belly button and into the back near your kidneys and down into the pelvis, as much as you can expand physically, and then exhale down and out the feet when you need to breathe. It's a pretty good refresher for like, oh, I am really out of my body right now. We call it the double down breath.
When you drop it down, you feel it kind of like sink down.
Yeah. So energy flows. Energy flows where attention goes. So,
yeah.
And the breath is guiding that energy.
So tell me about this Deeper Detox.
Deeper Detox is an online program that I created. It took me like a year to push this around while I was like doing my regular medical practice, osteopathic practice. And I wanted to create a way for people to interact with me who didn't live here. And so I created this intro to a detox where you're working on and learning about, it's actually a more educational platform than I thought it was going to be, but it's really just learning the mechanisms on like, what is detoxification? Where does it happen in your body? How do you support it? How and why are we so overwhelmed with toxins? What can we do about it in our homes, in our daily lives? Hopefully giving autonomy back to people, healing their own bodies, healing their family and friends. A lot of it has to do with binders. I use binders. I brought some binders for us today. This is the one I use in Deeper Detox, which is Chlorella pyrenodosa. It's a gentle binder, and binders do what they sound like they do. They bind on to toxins and help them escort them out of the body. Just teaching kind of the basics of a detoxifying lifestyle. Gone are the days of doing a cleanse once a year. And that's unfortunately just sort of the new reality, since we're swimming in a SHIT ton of toxins in our new world, from the clothes we wear to the air we breathe and the water we drink and the plastics and the whatever. One of my favorite teachers, who has been doing detox for a long time, since like the 70s. Her name is Ann Louise Gittleman. And she says that with the amount of toxins we have in our world, we actually need like 4 livers to do the job of just taking in life and excreting what we don't need. And unfortunately, we're not going to evolve to have 4 livers anytime soon. So I think it's important that we all know, how do we support a liver? What is a liver? How does it work? What can we do in our daily life to avoid stressing our liver? And a lot of people just say, oh, I don't drink alcohol, it's fine. Or, when I drink, I don't drink that. It's not just about alcohol. It's about a lot of other things besides that. So we talk about that in the program. We talked about asana practice being kind of the stage 1 of a yoga journey. And I consider these principles in Deeper Detox kind of a stage 1 in healing anything. Healing whatever you're going to heal, like you kind of have to know these basic principles for a chronic persistent condition, or gut stuff, or migraines, or whatever else you're going through.
And so the binder, when it's supplemented with some of these practices of detoxing, it helps get stuff out of your body.
Yeah, the problem with toxins is that most of them, so about half of them go out through our kidneys, and about half of them go out through our poop. Mm-hmm. A little bit out through our sweat, and a little bit out through our breath. But as far as like environmental toxins that we're taking in through our food and skin and things like that, we're mostly detoxifying by those 2 organs. And those 2 organs have a lot of mechanisms to reabsorb toxins, or to reabsorb things before you actually pee it out or poop it out. So the binders help keep those toxins in the gut lumen, or keep it in the kidney lumen, to actually like finish the job before just recycling and stirring up the pot of toxins, heavy metals, whatever.
That makes a lot of sense.
Yeah.
Do you recommend people take this just regularly as a supplement, or only kind of with some intention and some approach to detoxifying?
The reason I love chlorella is that it would be a safe thing to do on a regular basis. You get more serious binding capacity with things like charcoal or clays, zeobind, things like that are more specific. Some humic, fulvic acids. They're safe for a little while, like months, but not like ongoing for forever. Chlorella is actually just an algae, and so it's food. You can actually see like there's some vitamins and some protein in there, and it's a food based binder, and so it's not going to be binding like all your nutrients and things like that the other binders can. One thing that one of my Deeper Detox students said she now does with her chlorella is that when she has people over, like for a dinner party or whatever, she just goes around with a bowl of chlorella and hands it out. Nice. For people who are drinking their wine. I actually really love this for my wine ladies who love their glass of wine. I'm like, that's cool, but just take it with a handful of like 10 of these chlorella when you eat it. It's a little bit like an eraser, like, oops, I ate the whole pint of ice cream, or I had that extra glass of wine I should not have. But at least you can take the edge off your body having to process that by supporting it through a simple binder like this.
I think I remember the charcoal tablets being a hangover thing that people would take.
Sometimes, yeah.
Or like a hangover preventative thing. They might take it, that night with a glass of water.
Yeah.
And I think that was kind of the same theory, as it was helping.
I think different people love binders more than others. I'm a big binder person. I just really respond to it. Some of my patients love them. Some of people are like, I think it depends on a little bit about what you've got going on in your physiology and things like that. But I really notice it. Some of my patients really love incorporating the binders.
When is this Deeper Detox start again?
So it's a 6-week online. We meet once a week. We're going to do another round of this in the fall, in October.
Okay.
Yeah.
Cool. And this one's already happened. This group is.
We just did that group in January, February, and it went really great.
Nice.
Yeah.
Yeah. If you share the information with me, I'll attach it with all
That
this
would be
stuff.
awesome.
Which should anyone here locally know if they want to come, come to your practice and they want to inquire? Is it pretty straightforward?
Yeah, you can look at my website. I have two ways to get to that: drkirstenmackey.com and peakosteopathy.com. We'll get you the same place, and you can write us a message, email on there, or you can call, text, say I'm interested in becoming a patient. If you have any questions, you can drop them there, see if you're appropriate fit. Happy to jump on a call or reply via email.
Is there anything that you really specialize in, or anything you say like that's totally out of my range specifically?
That's out of your range.
No, no. Is like there anything that you say like I don't
Oh,
do anything there, and or like yes,
so your
that's fine.
friend with cancer, I'm not a cancer specialist. I don't know how to, I don't have the skills or training to approach that holistically. But pretty much like any primary care issue that you're interested in, deeper dive into root cause. Certainly I see a lot of structural issues, back pain and ankles and neck and migraines. I do see a lot of hypermobile people with EDS and just instability in their ligaments. So I do some injections to help stabilize that. I use prolotherapy and neural therapy to do that.
There's not nobody does stem cells in this state, do they? Are they legal here or no?
Not that I know of.
Mhm.
Yeah.
I don't know a lot about them, but
Yeah.
I definitely vague.
Yeah, I do refer to a couple of interventionalists in town who are doing ultrasound guided, and that's for like the deeper, more specific injections. If they want to do PRP, I've been sending people to Eric Adams, for instance. He's a great diagnostician on ultrasound. But prolotherapy is kind of like the first step to that. It's a lot less expensive. It's a lot less invasive, a lot less painful. So if you're wondering if a regenerative technique might work, it'd be worth starting with prolotherapy or neural therapy as opposed to these kind of bigger investments.
Okay.
Yeah.
Is there anything else anyone should know about you or about
Mm.
themselves?
About themselves. I don't know. It's too broad of a question.
Yeah. Hey, well, maybe there's one thing they should know about themselves that like sticks out,
What do they know? What should they know about themselves?
or just about you.
About me? Gosh. Yeah, I'm here to help. If you're local and you're wondering if there's another explanation to what you got going on, I probably have thought about that problem. So I'm here to help and try to work together as a team or with your team of healers. I just had a guy in there the other day who brought his physical therapist and his acupuncturist to his appointment. He wanted us all to work as a team. So yeah, I'm up for getting weird.
That's cool.
And
I mean, I thank you for what you're doing. I appreciate what you're doing because I'm on a constant journey to understand myself better and people in general. And it's cool that people like yourself are taking a holistic approach to what's the bigger picture here and not just isolating it down to one thing and kind of treating symptoms.
yeah, I appreciate you getting the word out.
Yeah.
Yeah.
Cool. Well, I'm going to link all your information about your practice and this deeper detox, and hopefully some people find you that need you. And yeah, thanks for helping out.
Thanks. I appreciate it.
Thanks for listening, folks. You can find the full blog post for every episode, along with key takeaways and links at mountain-mule.com. If you haven't yet, consider following the show. That one small action helps these Montana businesses get seen, grow, and thrive, and it helps this podcast keep going too. If you know a business that would be a good fit for the show, we'd love to hear from you. Just reach out through the website or social. Thank you for supporting these Montana businesses. See you on the next show.